Let's now identify the phrenic nerve. So here we're looking at the thoracic cavity. It's your right and left lungs. This is your heart, and there's going to be a nerve that comes off of the cervical plexus up in the neck and travels down through the middle portion of the thoracic cavity called the mediastinum, and this nerve is going to travel to and innervate this large dome-shaped skeletal muscle called the diaphragm. So here we see the phrenic nerve. The next nerve we're going to identify is we're going to bypass the vagus nerve and come back to that. We're going to identify the sympathetic trunk. So in order to see the sympathetic trunk well up in the thoracic region, we're going to need to remove the lungs and the heart from this cadaver image. And when we do that, we can see on both sides of your vertebral column, which run right behind these structures here. So this is the aorta, this is the esophagus, and this is the trachea. Just behind these structures is your vertebral column, and running just laterally on both sides of the vertebral column is known as the sympathetic trunk. We're only seeing the right sympathetic trunk here. The left sympathetic trunk is still covered up by some of these organs. The next structure to identify is the intercostal nerves. So the intercostal nerves, well, let's go ahead and remove the highlight on the sympathetic trunk so that we can make it out. So again, we're just seeing this neural structure running just lateral on both sides of the vertebral column. The next structure to identify here is the intercostal nerves, and intercostal meaning between ribs. These are nerves that run between successive ribs. So here we see them highlighted. Again, if we remove the highlighting, we see them again. Let's go ahead now and identify the vagus nerve. Okay, here we see the vagus nerve. The vagus nerve, kind of in a similar position as the phrenic nerve, is going to be running through this middle part of the thoracic cavity. So here we see the left vagus nerve. The vagus nerve is going to be sending neural fibers to the heart. So we're not going to see this nerve extend as far down as we did the phrenic nerve. The next nerve for us to identify is the genitofemoral nerve. So let's go ahead and do that. Okay, so here we're down in the abdominopelvic region, and we see the genitofemoral nerve. Oftentimes the genitofemoral nerve is going to pierce this large muscle here, which is the psoas major muscle, or it lies on top of the psoas major muscle rather, and we can see it highlighted here. Again, if we move the highlight, that would be your genitofemoral nerve. The next nerve for us to identify is the obturator nerve, so let's go ahead and do that. Here we see the obturator nerve as it comes off of lumbar plexus. That obturator nerve is going to be viewable in some different positions, which we'll see it lying in the medial groin region shortly. Let's take a look at and identify the femoral nerve. So again, here we see the femoral nerve, a large nerve that is going to run into the upper region of the lower limb and innervate structures of the upper leg. Okay, so if we take a look here, we see that femoral nerve where we saw it up here in the pelvic cavity as it passes underneath this structure here, which is called the inguinal ligament. We can see it emerge from the top part of the thigh. So this is our femoral nerve. In this position, we can also see the obturator nerve very well. So we see that obturator nerve right in that position. And I can highlight that for you there. So we saw the obturator nerve up in the pelvic cavity as it passes underneath this inguinal ligament and emerges. We can see that in the medial groin region. That's the obturator nerve. The next nerve to identify is the sciatic nerve. The Let's identify the saphenous nerve first, because the saphenous nerve is going to be seen a little easier in this position. So here, this illustration to the right, we can see the saphenous nerve is a very long nerve that is a branch off of the femoral nerve that runs down the medial part of the lower leg and foot. Okay, here we see the sciatic nerve very well. It's the largest nerve in the body. This is a posterior view. This is the buttock region. Here we see the sciatic nerve. As the sciatic nerve passes distally through the posterior thigh, we can see that it branches and it gives rise to a nerve that's known as the tibial nerve, and the other branch is known as the fibular nerve. So we can go ahead here and we can identify the tibial nerve. So this more medial branch here is going to be our tibial nerve. Again, sciatic nerve is going to branch into the more medial branch is the tibial nerve, and then we see a branch come out here laterally, and that is our fibular nerve. Here we see the fibular nerve. The tibial nerve is going to continue medially. It's going to run through the popliteal space, or the popliteal fossa on the posterior aspect of the knee. It's going to continue running along the length of the tibia and then go around the medial malleolus. The fibular nerve is we're going to give rise to what's known as the common fibular nerve, which we see here, and I identified here as the lateral branch off of the sciatic nerve, and this common fibular nerve is going to give rise to a superficial and a deep branch. You do not need to know the superficial or deep branches, just the common branch.